Hi everyone, it's Dr. Marian Owen with Whole Family Medicine, coming to you from my backyard on May 2nd, 2020. Update on how things are going at the office, what we're seeing, what we're thinking about COVID and the governor's recent orders that say we can go back to normal and not worry about anything. Didn't quite say that. And just a little catch up for you. So at the office, we are still acting like the concern for COVID-19 is as grave as it's been. It is a highly contagious disease, and we are acting that way. So if you need us, we are still triaging over internet, e-visit, or a phone call if you prefer. Insurance is covering that like a regular visit at this point, so we're just billing it like that. And then if something comes up during the call that we either need to see you for or get a laboratory for or manage in some way that requires you coming in, we have been scheduling patients coming through the office. We're still maximum 3 people moving through there a day. And we try to keep it so that only one person is in the office at a time. Between patient visits, we follow you around and wipe everything down and make sure that all surfaces are back to as clean as we can make them between visits. So if you need us, call or go through the portal or email, whatever you prefer. You know that email is not HIPAA compliant, so we prefer you use the portal, but that is up to you. And that you let us know what you need, and we will try to triage appropriately, get you in, get you scheduled for an e-visit, whatever it's going to take. And we are finding that many things we really can handle very well over the phone. Susan and I both feel a little handicapped by not being in conversation personally with our patients. We pick up a lot from that interpersonal interaction, and so feel that while we're not able to do our very best for you without you being in the office, we are able to meet your needs and keep things moving along for you. So if there's something you've been putting off because you feel like we're so busy or whatever, you needn't put it off. We will figure out how to manage your continuing and ongoing health situations, because that's what we're going to have to do. This is going to drag on. It's going to drag on until we have vaccines that work or until we've all gotten it and gotten over it. And so that is just the reality, and we're going to have to figure out how to manage in this reality. So that being said, currently there are some changes that are happening within testing, and I have heard from a few of y'all asking about antibody testing. I want to say that at this point, I don't feel that any of our testing is completely reliable. Data that I have seen indicates that even the immediate nasal swab tests, even during peak viral loads in patients, are only positive 80% of the time. And so often it takes a repeat test to get to that positive test, even in very, very sick people. So we are facilitating testing. We're not doing it out of the office at this time. There are clinics around that are set up to do it more safely than we are able to, because we do not have appropriate PPE to contact cases that we think are very possible to be positive, and so we're referring those to places that can handle that more safely for everyone involved. But we will facilitate you getting in and getting those tests done if we feel that's needed. I do want to emphasize that everything that's making people feel bad is not COVID. You can still have strep throat. You can still get the flu, although we haven't seen it in a long time. There's still the summer colds going around. There's still GI bugs. So just because you're getting a little sick doesn't mean it's COVID. Don't panic. Even if it's COVID, don't panic. We will help you figure out what's going on and give you the best advice as we have it at the time. The new antibody testing that is rolling out, I don't think is very accurate yet. I have heard from a few labs, encouraging me to send patients to them. But when I ask specifically about the characteristics of the test, how the tests are done, and these are kind of statistical words, sensitivity and specificity. Those are two things that they should be able to tell me about the test, like how likely is the test to be positive if someone is sick, that's sensitivity. Specificity, if someone is positive, how likely is that to be true? Or if it's negative, how likely is that to be true? How specific is the test to that disease? And a lot of these early comers to the market are not being able to delineate between COVID-19 and other coronaviruses, which, as you know, are very common. The common cold is a coronavirus. So if you can't delineate between those, it's not a very helpful test in terms of antibodies. And even if we do get a good antibody test, we at this point still do not know if you have antibodies to COVID, meaning I've seen COVID and fought it off, do those antibodies actually decrease your risk of getting it again? We think so. But as in the case with the common cold, those antibodies wane year after year, which is why you get the cold again every year. And so that may be the case with this one. We don't know. So I'm not sure getting a positive antibody test, it might be falsely reassuring to you. Oh, well, I've got antibodies. I can go out and do whatever I want. There's no data at this point to make us feel that comfortable. So I think we all need to continue all the things you've been doing to protect yourself, keep your social circle small, keep your contacts minimal. But that being said, I do think some people are feeling frozen by this, and I don't think you have to be frozen. Most people, if they get this, are going to be sick, but fine. And so it's not, I'm not particularly worried about me getting it. I'm not particularly worried about my children or my husband getting it. I hope they don't. I don't relish the idea of being sick for 3 weeks, and you're seeing things coming out about potential for a stroke and things like that. I don't want those risks, but I think those risks are extremely low for anyone under 50, anyone in these lower risk groups. However, most of us have people in our lives that are higher risk, and I think it's incumbent upon us to protect them, and that is why we need to continue. That's why we need to continue the social distancing. We need to continue to do the things we have to do to keep those members of our community safe. So I do not encourage you to go to restaurants and sit down and have a meal. I think that is a really bad idea. I obviously don't think you should go get a haircut. I would love to go get a haircut, but this is just going to get long and scraggly, and yours should too. I'm not going to take my dog to the groomer. He's going to get yet another scissor cut, and it looks terrible, but it's all right. He's a dog. These are things that are annoying but not worth risking those exposures for. Don't think you should go get a tattoo right now or go bowling. Those are not reasonable things to do during a time when there is a highly communicable illness in the community. So though we have been approved to go do these things, I think you should be staying home most of the time. We have had a few gatherings with friends out here in our backyard where people bring their own beverages or snacks. We have had one person over for dinner. We did that very carefully, and it was a low-risk exposure, and we were low risk, so we felt okay about it. But we're not like gathering with a lot of people, and I'm not going to go to church right now. So I think that there's a balance, and each one of us needs to strike that balance. And if you need help thinking through your risks and the potential exposures for people that you love via your exposures, please give us a call. We'd be happy to help you think through that. Of course, the most prudent thing to do is to absolutely limit your exposure to anyone who is high risk beyond just supporting them. But they may make the choice that they'd rather be with their grandkids than not be with their grandkids for the next year and a half. I don't know. And that is every individual person's choice, how they want to manage this. What's not okay is if you take that choice and then increase someone else's risk, and it's not okay with them. So when you're in the grocery store, wear your mask. Even if you're not worried about getting it, you might be spreading it. So do the socially responsible thing there. But don't be frozen. Don't not do anything. Reach out to your friends, reach out to your family, do some fun things. We went to Arabia Mountain yesterday. My husband and I took a hike. It was beautiful. There were a lot of people there, but at Arabia, it's a big open space. You're able to kind of dash around people. And so go places like that where you can be in nature, be outside, walk around, but not where you have to be crowded together. So I understand Piedmont Park is pretty crowded, and I wouldn't recommend going there. So going up into the mountains might be a safer choice. Don't spend your next year and a half afraid to live your life. We can't do that. Again, even our most vulnerable people, if they get it, most of them are fine. So it's not. It's a funny balance to strike, and I think we're all going to have to work that out over the next few months, because there's no way we can all stay inside for the next 18 months. We can't do it. We will go crazy. The economy will collapse. But it's not my job to think about the economy or your finances. It's my job to think about your health. But even just your health, considering that, I think it's really important that you start to think about how you can safely expand your circle and expand your social contacts a little bit. Again, at a distance, appropriately, but don't lock yourself up too much. I'm worried about that for some of y'all. So those are the things I've been thinking about. I don't think I have much else to add. Someone asked me to show an example of some of my very, very bad watercolor, so I'm going to. Here you go. This one you'll never see anymore because, again, I'm not very good. But here you go. There's, let's see, Smoky Mountains, North Carolina, sunset, sunrise, don't remember, but that's my effort. So write that down. You'll never see it again. Now it's your job to share yours. All right. I hope you guys stay well. Let us know if we can do anything. Know we're here for you.